We were talking with a CFO and an HR director about a year ago, and we asked them, what is your healthcare strategy? Where do you want to take your healthcare program? And the CFO kind of cocked his head and looked at us and was like, I have no idea what you guys are talking about. Healthcare strategy, healthcare program, what does that even mean? And so we explained and elaborated, and then we talked to them again a year later, and the CFO comes to that call and says, hey, before I met with you all 12 months ago, I didn't even know you could create a healthcare strategy. And over the last 12 months, from our initial 20-minute conversation, we've worked as a leadership team to make that a priority, and we're moving in the right direction to stop buying health insurance and to creating a healthcare program.
Yeah. And so then let's talk about phase 2 of this. After that core leadership team, at least talks about, hey, what are we doing? Is it good? Is it bad? Or do we just not care? And that may be the outcome. We don't know. But phase 2 of the groups that do care and they do start working on a plan and a strategy and they, have a written document and they understand where they're going. Phase 2 of that is to start engaging that second level of key leaders. This has been the number one thing we've seen the highest performing companies when they decide to take control of their healthcare and benefits program. It's the number one thing they can do. And it's a lot easier than you think. But getting that second group of key leaders involved in the healthcare and benefits program, they start becoming curious as to, how did we get here? Why are we doing what we're doing? Where are we going? How does it impact me individually, and what can I do for the better of the group? With employee-owned companies specifically, this is something that we see is where a lot of traction and a lot of ground is made up relatively quick.